Hi everyone, and welcome to my in-service presentation. My name is Carolyn Keene, and I'm a second-year student in the Occupational Therapy program at the University of Tennessee Health Science Center in Memphis, Tennessee. This in-service will cover the topic of functioning as a productive member of an interdisciplinary team. Our learning objectives for this in-service are: learners will define what an interdisciplinary team is. Learners will identify qualities that productive members of an interdisciplinary team possess, and learners will identify how interdisciplinary team care is beneficial to our clients. I wanted to start out by saying the Accreditation Council for Occupational Therapy Education, otherwise known as ACOTE, Standard B425, Principles of Interprofessional Team Dynamics states, demonstrate knowledge of the principles of interprofessional team dynamics to perform effectively in different team roles, to plan, deliver, and evaluate patient and population-centered care, as well as population health programs and policies that are safe, timely, efficient, effective, and equitable. I wanted everybody to take a minute to flash back to our foundations class, and we're going to do a little bit of retrieval practice. In foundations, we talked about interdisciplinary, multidisciplinary, and transdisciplinary care. I wanted everybody to take a minute to jot down what you remember about these types of healthcare teams, and then we can go through the definitions of them together. Okay, once you've had a minute to do that, I'm going to go over these definitions. The definitions for these terms comes from our Foundations textbook, Introduction to Occupational Therapy. Interdisciplinary, maintain their own professional roles while using a cooperative approach that is interactive and centered on a common problem to solve. Multidisciplinary, a variety of disciplines or professions work together in a common setting. However, the relationship between the team members is not interactive. Transdisciplinary, involves members who cross over professional boundaries and share roles and functions. In this approach, there's a blurring of traditional practitioner roles. I wanted us to be able to define interdisciplinary before moving on. And it is important to note that another term for interdisciplinary is interprofessional, and these two terms will both be used throughout this presentation. To be able to know how to function as a productive member of an interdisciplinary team, we have to go more in depth. The overall goal of interprofessional collaboration is client and family engagement in the care plan that translates into a sharper focus on treating the whole person and not just diseases and body functions. And with interprofessional care, there are 4 core competencies for interprofessional collaborative practice. The first core competency is values and ethics. We want to work with individuals of other professions to maintain a climate of mutual respect and shared values. In the end, we all are working towards the same goal, which is helping the client improve. 2, roles and responsibilities. The use and knowledge of one's own role and those of other professionals to assess and address the healthcare needs of clients and to promote and advance the health of populations. We need to be familiar with not just only what we do, but what other professions do. That way we are able to make referrals to the proper professions. 3, interprofessional communication. We want to communicate with clients, families, communities, and other professionals in health and other fields in a responsive and responsible manner that supports a team-based approach to the promotion and maintenance of health and the prevention and treatment of disease. And 4, apply relationship building values and the principles of team dynamics to perform effectively in different team roles to plan, deliver, and evaluate client population-centered care. in a safe, timely, efficient, and equitable manner. Our next step is then to identify what other professions we can work with to provide interprofessional care. I want everybody to take a couple more seconds to jot down what other professions that you think of that we could partner with. Really think about our older adults class that we're in right now and all the guest lectures that we're hearing from and all that. So I'll get back to you guys once you have a minute to do that. Okay, so some of these professions include activity directors, audiologists, case managers, dietitians, nurses, mobility specialists, PTs, physicians, psychologists, respiratory therapists, social workers, speech language pathologists, visions, vocational counselors, and the list goes on and on. What does working on an interprofessional team look like? So I'm sure some of us have had the opportunity to see what an interprofessional team looks like, whether we shadowed and saw this, or we worked as a therapy technician and were able to witness this. And many of us also saw it on our first level 1 pediatric fieldwork. But don't worry, if you haven't had a chance to see the inner workings of an interdisciplinary team, you might get to do that on your level 2 fieldworks. And you'll also be able to collaborate with them to form treatment plans. So you will have the opportunity to meet with other professions in which you plan the overall care of the client while maintaining awareness to the client's needs, goals, responses, wants, and then it's all about the client. You'll be a mutual source of information and support in treatment. And there will also be times when you are co-treating, such as an example with a OT and speech and language pathologist, where the speech and language pathologist is looking at the client's swallowing, and we're working at the muscles that they're using to swallow and the act of eating itself. In order to be a productive member of an interdisciplinary team, you're going to need some key qualities here. And we've learned all this in foundations too. So think back to your little human cutout and what you wrote on there. Those are all good qualities to have when working in an interdisciplinary team. Some of these included effective communication skills. A new one is understanding the roles of other professions and professional boundaries. We don't want to overstep into something that's not our scope of practice. Understanding group processes, being open-minded, being willing to take in new ideas and try them out, and being tolerant of change, being respectful, and then overall shared decision-making skills. You're going to be working with this interdisciplinary team to make decisions about what everybody thinks is best for the client based on what they told you. Now that we've gone more in depth of what an interprofessional team looks like, we need to understand how it's different from traditional care. So with interprofessional care, the conversation and plan formulation includes the client. In traditional care, many times physicians and nurses would step out into the hallway and talk about the client as if they're not part of their care at all. They just make the decision for the client and be like, well, this is what's going to happen based on what they look like. Totally different in interprofessional, interdisciplinary care. We are holistic and we want to know what the client wants to do in order for everybody to be able to help them meet their goals. Everybody on the team has a role, voice, and space to contribute, and everyone understands the language to use. So sometimes, and we have our own little OT jargon, but we need to work in a language that everybody understands and not use like MMT, like everybody knows what that means, because they don't. So the focus is going to be on people, needs, and goals rather than than disease treatment and task. Professionals collaborate on interventions and checklists are made, ensuring that everything about the client's goals is met. How is interprofessional team care beneficial to our clients? Interprofessional team care can address all of our clients' needs. Everyone on the team will be aware of the client's goals and will be actively working to help the client achieve those goals within their scope of practice. The client has a voice and is included in every single conversation that is going on about their care. However, some barriers do exist in interdisciplinary care. These include uniprofessional mindset. So just like that example earlier, medical jargon specific to one profession, and not everybody's aware of what each abbreviation means. Another one is organization, environment, and priority payment and priorities. So most of the time, payment sessions to get reimbursed, it's a one-on-one session. And what we're seeing with interprofessional care is that we want to bill for all the services. There might be sessions where all three of us are working in the same thing, and it's not a one-on-one treatment session. And so we need to update organization systems to be able to bill for interdisciplinary care. And another one is just simply lack of training and teamwork. So whether somebody went to a school where they didn't assign that much group work. However, we are very lucky to be able to have had anatomy with the PT students and another class with them and learn from them. But also we learn from each other in our own groups because we have a group assignment in every single course so far. Lastly, some tips and strategies for being a productive member of an interdisciplinary team. So, practice your active listening skills. Hear what other professions are saying and take it in and maybe use it in your treatment session. Just be open-minded, willing to learn. We're always learning across the lifespan and want to continue to do so. And be confident in your knowledge and skill set and be willing to share it. Thank you for watching my in-service presentation, and I hope you are ready to take on being a productive member of an interdisciplinary team. If you want more information about interdisciplinary care before your fieldwork, please check out the 2 articles on Blackboard. One is called Core Competencies for Interprofessional Collaborative Practice, and this was created by an expert panel. Another one is done by the World Health Organization, and it's called the Framework for Action on Interprofessional Education and Collaborative Practice. If you go to Blackboard, you can find the link to a Google form and a Padlet. If you could, please complete these by August 16th at 11:59 p.m. You can also find an example script that I created to simulate an interdisciplinary team meeting. Thank you for watching my in-service presentation, and I hope you're ready to take on being a productive member.